Hello, Ben. Guess what? We're in a new briefing room. I've got no sound. Have you got sound? Can't hear a word. You can't get hear him either. Alright, okay. Just shut him up for a minute. Oh. The good news is at least the guy next to him's doing the other stuff.
We can all build our own individual defences against COVID and enjoy ourselves at the same time.
Unless people...
Let's assume there was no sound early on.
To freedom is to follow the rules and remember outdoors is generally much safer than indoors. Exercise to have fun. We can all build our own individual.
So I thought it was my end and it was their end.
And enjoy ourselves at the same time, and that is to take more exercise. And so I'm personally thrilled that I will be able to play tennis, for instance, and without being remotely preachy, I do hope that we can take advantage of this moment and the beautiful weather to play sport, to take exercise, to have fun, and build our national resilience in that way too. And remember that outdoors is generally much safer than indoors, and the way to continue on our cautious but irreversible roadmap to freedom is to follow the rules and remember hands, face, space, and fresh air.
Just to let you know as well.
Thanks very much. I'm now going to...
I'd already knew there's a new stage.
Thank you, Prime Minister. First slide, please.
Although they've took 2 of the flags out.
So the first slide shows the pattern since September of the number of people testing positive for COVID in the UK, and as you can see, this has dropped a long way from the peak in January, although it is now flattening out, and I'll come on to why that is in a minute. Next slide, please. Fortunately, the number of people in hospital with COVID in the UK is continuing to fall, and as you can see, this is now down to much lower levels than it was last month and the month before.
Well, we can't see anything because the guy's in the way.
Next slide, please.
Thank you.
And the best news really on this is that the number of deaths of people who had a positive test for COVID in the UK is continuing to fall. And the most recent 7-day average is 63 deaths. Next slide, please. And this is partly due to lockdown, and a large part of this is due to lockdown, but also partly and increasingly due to the vaccine rollout. And this slide shows the steady increase in the blue bars of people who've had their first dose of vaccine, and in the orange at the bottom, those who are having their second dose of the vaccine. And as the Prime Minister said, the number of people having a second dose is going to increase significantly over the next month, and it is essential that people do come for their second dose. Next slide, please. I thought we should show 2 slides, really just to put a little bit of detail on this. And the first of these is to compare the age distribution of people who sadly have died from COVID.
Yeah, people will go mad for this.
And what you have is the ages steadily going up from 0 to 4 at the bottom, up to 90 at the top. And the red line is the point at which vaccination has reached. So it's reached down to those who are 50 and above, plus people who got pre-existing health conditions. The final cases have been found, and I really want to stress that anybody who in that group, in those 50 or above, who has not been called for a vaccination should make contact with their doctor. But, and this is an important but, on the right, what we have is the total number of people who have actually acquired COVID, and as you can see on that, the great majority of people who've acquired COVID are actually younger than this. So the majority of transmission is in younger age groups who have not yet been vaccinated, unless people have got pre-existing health conditions, or they're a health or social care worker, or care for someone who is vulnerable. So we therefore anticipate that as there is gradual unlocking in the way the Prime Minister has described, it is inevitable that there will be some increase in the number of cases, because the people who are most likely to catch and to transmit COVID are in that younger, unvaccinated group. So the vaccination has had a really big impact on helping to protect against people dying from COVID, although it is not a complete protection, but it will have less impact on transmission because of this age distribution. Next slide, please. The second new point I really just wanted to make, and then Sir Patrick is going to make a point about vaccines, is to say that the bit of the roadmap opening up that has happened so far is opening up schools. And what you can see on this, and I think this is likely to become clearer over the next 2 weeks, is that there has been a steady decrease in the rates of COVID over the last several weeks in most age groups, but there's been a flattening and possibly even a slight uptick in transmission amongst people, children of school age. This isn't a dramatic increase at this point, but this is inevitable that as bits of society open up, there will be some increases in transmission, and we should expect that. That is one of the things we have to anticipate will happen as some opening ups occur. So Patrick just wanted to make some additional points on the vaccine.
Thank you. Can I have the next slide, please? So a few points about vaccine. If you look at the left-hand part of this figure,
I'm confused. I like graphs normally, but
this
bloody
is
hell.
giving an illustration based on the current and recent rates of infection across the community, roughly how many people you'd expect to be in hospital or to be hospitalised over a 4-week period. So if you take the top age group in the 25 to 34 age group, out of 100,000 people in the population of that age, over a 4-week period, roughly 7 people you'd expect to be hospitalised. If you go to the next age group, 35,
You need a degree to understand this stuff these
100,000
days.
people in the community over a month, 4-week period, you'd expect roughly 14 people. 45 to 54, 21 people, and 55 to 64, 29 people. If you went to higher ages, of course, you get even more. So this just reinforces the point that as people get older, the risk of hospitalisation from infection is greater.
Well,
Now,
that's
if you look at
something.
the right-hand side, this tells you what would happen if all of those people were vaccinated. So if everybody were vaccinated, and this is taking a single dose, so it's giving roughly an 80% protection, you'd find that in the youngest age group there, 25 to 34, instead of there being 7 people hospitalised over a month, it would be 1 or maybe 2. 35 to 44, instead of it being 14...
We've got it now, you don't have to explain it to us.
2, 3. As you go to the higher ages, 45 to 54, instead of 21...
I've got it now, now you've explained it, I get it.
And at the highest age group on this, 55
It's 6,
to
yeah.
64, it
No.
would be roughly 6 people instead of the 29.
Yeah.
So
Right.
there are 3 points I want to make. First is the one that as you get older, there's a higher risk from this disease, as Chris has also shown.
I think we already knew that.
Second is that the vaccines are very effective at reducing hospitalisation in everyone who gets them. And so the message
I
is
still haven't had mine.
everybody who's asked to come forward for a vaccine, please get the vaccine.
Yeah.
But the third message is that the vaccines are not 100%.
It's like one of them Christmas
And this is
lectures,
current
it is,
rates of
definitely.
infection. If the rates were much higher, then obviously the amount of hospitalisation would be higher, which reinforces the point that the thing that we all must do is try and keep rates down and be sensible as we unlock and get back to more interaction. Thank you.
Thanks very much, Patrick. Thank you, Chris. Let's go to Beatrice from London.
Hi, Beatrice.
With restrictions easing, people are slowly being reunited with their families. For those with family abroad, they have not been able to see them for months. Will a similar easing take place for those with family abroad, or will seeing family be incorporated as an exception to international travel, like the exception to travel for business purposes?
Beatrice, thanks very much. I think that the most important thing that we've got to do right now as we continue to immunise great numbers of people in this country is protect our country insofar as we can. It's never going to be perfect, but do as much as we can to prevent the virus coming back in from abroad and new variants coming in from abroad. So the rules about what you can do, what people can do to see their families abroad will be governed entirely by the
Layman's
rules
terms
that,
would be easier.
Travel abroad and people coming from abroad. So at the moment, as you know, it's still forbidden to travel. We'll be saying a bit more on April the 5th about what the Global Travel Task Force has come up with, and clearly at the moment
We need JVT, don't we?
you know, there are lots of
You can use an
countries on
analogy.
a red list, 35 countries on a red list, where we have very stringent measures in place for them, for people arriving from those countries. They have to go immediately into hotel quarantine, and if you're coming from anywhere else, you also face pretty tough quarantine rules. So we will be, Beatrice, we will be saying more about seeing
Is anyone going to tell them that we didn't hear the first part of this speech? Can you do it again, please?
It won't be until at least April the 5th. Anybody want to say any more on that? Thanks, Beatrice. Let's go to Julia from Margate. Julia asks, myself and my husband have had our first dose of the Pfizer vaccine and are due to have our second dose at the end of April. Will this be impacted by the recent shortage of supplies, and what does the government plan to do about it? Well, Julia, I think I can answer that question very briefly and succinctly by saying that that there isn't any need to worry about shortage of Pfizer for the second.
It's a new camera
dose
angle, isn't
as
it? This
far
new
as we
studio.
see at the moment.
It just
And
looks like the old
we're gonna
studio
continue
with
to,
some
to
blue
roll that
cardboard
out
stuck
and,
up on the
and
walls.
supply that. And as I said, April is going to be the second dose month. Very important that everybody gets their second dose. Hugh Pimmer from the BBC.
Thank you very much, Prime Minister. Isn't there a danger of mixed messaging when you talk both about a roadmap to freedom and getting back towards normal life, but also the need to be cautious because of cases rising in some parts of Europe? And a question for Professor Whitty and Sir
Train
Patrick
streaming
Vallance.
along
How
105 mile an
concerned
hour
are
with a
you
vaccine.
about
Let's
what's
not
happening in
blow
some
it now.
European countries with
Yeah,
cases
exactly.
and what that might mean for the UK? And have you given your approval to the next stage of easing on April the 12th, the opening of outdoor hospitality and non-essential retail and so on?
Well, thanks very much, Hugh, and you're absolutely right that we're pleased to be able to have some measure of relaxation today. It is important, it is valuable. I know it will be prized by people, but also very important to stress that we are continuing to be cautious, and the whole point about the roadmap and the timescale that we've got is it gives us a chance.
You're wondering why we're delayed? It's because there was issues earlier on, but I didn't know whether it was me or them. So I'm watching this as live, about 2 or 3 minutes behind.
The 12th phase
So don't think you've gone mad.
That in due course, obviously. Same goes for May the 17th, June the 21st. They all depend on the four conditions. But I wonder whether Chris or Patrick, you want to say more?
Yes.
Sorry.
Oh, sorry.
No, Patrick, you go.
Well, I think when we discussed the gap between stages, the idea was to have 5 weeks to allow data to be assessed in the 4th week, which is the earliest we think we can get a good handle on what's happened. And so that's next week. So that's when the analysis of the effects of the initial opening of going back to school can be assessed, and at that point we'll be able to give the recommendations. So far, as Chris has laid out, everything's moving in the right direction, but we need to do a formal data analysis next week.
In terms of the, are we concerned about what's happening in Europe and elsewhere? Well, I mean, in those, anybody would be concerned about any country in the world where rates are going up, because that has a big impact on people's health and lives. So I think, as citizens of the world, we will all be concerned about any of those countries. For the UK, there are 2 risks. There's always a higher risk.
I think it's a case of we'll get used to it in time. It's the new normal, isn't it?
Importation of COVID. But the much bigger risk, and the one that we're all concerned about, is the risk of variants of concern. These are COVID variants which might, and I want to stress the word might, have a problem with the vaccine, where the vaccine is less effective against them. And so the main thing we're concerned about is the risk of importing into the UK variants which could have a reduced effectiveness of the vaccines we're currently
There's a mark
using.
on the blue there above the letter T of Downing Street.
But in the short term, that is the principal thing that's driving.
There's a little nick in the wall there.
Issues at this
This has
stage.
cost over £2 million. A bit annoyed by that.
It's not really for Sir Patrick or me to give approval of things, but certainly we've been involved heavily in all the decisions in terms of giving technical advice to ministers.
Thanks very much, Hugh. Carlton and ITV.
Thank you, Prime Minister. There's a great sense of release around the country today with the lifting of some restrictions. Right. Do you worry at all that people...
It's got 2 pictures on the wall now on the side, on that side.
What sort of warning would you give people who are tempted that way? And for Professor Whitty...
oh no, it's just got 1.
How the
that makes that
artwork
there's just ridiculous.
Do you worry
I'm into
that today's relaxations could also
interior design at the minute, you know,
in the numbers of cases, and how well at this point do you think we are protected by the vaccination program as a country?
Carl, yes, you're absolutely right to put the emphasis on caution. The vaccine rollout has been very impressive, and thanks to everybody who's been involved in it.
Look, it's got microphones hanging from the ceiling as well.
What we don't know is exactly how strong our fortifications now are, how robust our defences are against another wave, and we've seen what's been happening. That's why I stress what's happening with our European friends, because historically, at least, there's been a time lag, and then we've had a wave ourselves, and that's why I just stress the importance of everybody maintaining the discipline that people have shown for so long, and continuing with the cautious but we hope irreversible roadmap that we've set out.
In terms of the question you asked me, yes, there is a high likelihood that there will be some uptick as a result of the relaxations today, and that was anticipated right from the beginning of trying to lay out where the roadmap would go. And if you think about the graph that I showed, what it shows is that the high proportion of those who will both catch and transmit COVID have not been vaccinated yet. So I would not anticipate that vaccination will reduce transmission between people in those ages at all at this point in time. But, and this is the big but, the point the Prime Minister was making, and that's been stressed repeatedly, is that if people stick to social distancing rules and they're outside, the risk of transmission is massively lower than if they are very close together and inside. So provided people are sensible about these, and people throughout the entire COVID pandemic in the UK have really been very sensible, incredibly respectful of sticking to the rules and guidelines. Provided people stick to outdoors and at a distance if it's people who are not in their households, the impact in terms of an uptick should be modest, but I think it would not be realistic to think there will be no impact, and that is something we're all aware of.
The only thing just to add is it's important to remember as vaccination rolls out that once you've been vaccinated, it takes 3 weeks or so before you get some protection from the vaccine. It's very important to recognise that even when vaccination, it's not an instant thing. It takes a time for the immunity to accrue.
Brilliant, thanks. Beth Rigby, Sky News.
Welcome back.
Thank you. Prime Minister, you've asked a lot of the British people over the past year, and now,
She's very naughty.
even as that vaccination programme's rolled out and cases are now at their lowest level since last October, you are still hugely restricting our personal lives and our liberties. Do you accept that you are testing the patience of the public? And are you concerned that people will stop listening? And to Professor Whitty,
she's one to talk, isn't she? She went to a party in November, whenever it was, last year, for Kate Burley's 60th birthday, and got suspended.
At risk of a third wave, the sort we're seeing in continental Europe, or can the British people finally begin to relax? And just quickly to Sir Patrick,
for God's sake,
when will the doses, those 50 to 60
you have no authority here,
just talked about of the Novavax vaccine, when will they be available?
Let me go straight back to you, Beth, on that point about asking a lot of people. And yes, of course, I accept that, and I know how much government has asked of the people.
She ignored it
in the last year.
She went to a fucking party.
Magnificently, with what incredible patience and
She's got suspended from work for 6 months.
It's my view, Beth, that overwhelmingly people are determined to continue to
Beth Rigby has no authority here.
The need for
questions
caution.
like that.
And I think overwhelmingly people understand that when it comes to this roadmap, the better we stick to it, the more cautious we are, the better the chance we have of making sure that it is indeed irreversible and we're able to go forward in the way that we want.
In terms of the question you asked to me, what Patrick's slide I think showed is that we do have a kind of a wall of vaccination that will get stronger with the second vaccines, and I want to repeat my emphasis. It is critical people get their second vaccine, but it is not a complete wall. It's a kind of leaky wall, and therefore there will always be some people who either have chosen not to be vaccinated or where the vaccine has had much less effect. And if we get a small surge, there will be cases of people who have been vaccinated who will have severe disease, and there will be cases of people who are not vaccinated, a much higher proportion, who will get severe disease, and some of those will go on to die. If we get a very big wave, that would obviously lead to a significant impact. So that's the reason why the Prime Minister and ministers have been absolutely determined that this is a slow and steady unlocking, looking at data
Beth
between
Rigby,
each step.
Sky News.
Because what we accept that with this highly transmissible virus.
According to Wikipedia, Elizabeth Frances Rigby is a British journalist.
Vaccines will help hem it in as we go down the ages, but it's going to take a while before we've got the full protection, and even when we have, there will be some upsurge. The key thing is to keep that rate down and to make sure as many people as possible are vaccinated, in particular the most vulnerable.
And keeping the rate down also stops the likelihood of more variants emerging. So it's important we keep on top of this. the Novavax question about is an operation.
Oh, there you go. In December 2020, Rigby, Beth Rigby, was criticised for breaching London's Tier 2 coronavirus restrictions by attending a restaurant to celebrate the birthday of Kai's presenter Kay Burley, and was taken off air until March.
They're already making the vax pending the
So don't you dare
approvals.
question people's...
Daily Mail.
Yeah, go away.
Thank you. Professor Whitty, if someone's had both their vaccine shots, as many people now have, why shouldn't they hug their grandchildren this Easter? Are they not now as safe as they're going to be for the foreseeable future? And Prime Minister, you mentioned the encouraging signs on some of the graphs. The death rate now is round about where it was when we unlocked indoor socialising last year. If it was good enough to do that last year, why isn't it good enough to do that this year?
Because the cases went up and people died. Oh, Jesus Christ, these journalists, they thought they had degrees and things.
The thing to understand with vaccines is they provide increasing levels of protection as we go through. The first vaccine provides a high degree of protection. The second vaccine for the same person provides greater protection, but there's still some vulnerability. This is the point that Patrick's slide was making. Then actually having people around someone who has been vaccinated, who are themselves vaccinated, provides a further level of protection. And then the key thing is keeping the rates right down, makes it very unlikely that someone who comes in, even if they have been vaccinated,
even people who were working in pubs and restaurants that I knew said it was too early to go back last time, and they were proved right.
But what we're trying
so
to do
that
is
is the stupidest question. Makes Beth Rigby look sensible.
We're not yet at that stage. We're getting there.
That's why I don't buy the Daily Mail.
The extraordinary rollout by the NHS, I think, is really remarkable, and that is going through at a real pace.
Not angry.
But the great majority of people have not yet had their second vaccine, and if they're meeting people who are under the age of 50, they will not have had their vaccination unless they actually have a pre-existing health condition or are a healthcare worker. I would like to re-stress a point that Patrick made also, which is that people are not immediately protected when they're vaccinated. And I think it is important for people to remember that there is a period of time if you're an older citizen, maybe 3 weeks or so, between the time that you get vaccinated and the time when the protection kicks in. It will be good protection, but it won't be absolutely complete protection.
I think that's an incredibly important point for everybody to remember right now. And Jason, I think the answer is to your question is really contained in some of the slides that we saw earlier, where you already, because of the relaxation that we've seen, or almost certainly because of the opening of schools.
There was no BIM today because there was no sign, DC.
Some of those graphs started to curl a bit like old British rail sandwiches, moving upwards a little bit in the younger groups. You've seen what's happening in the on the continent, and we've seen that happen before. That's why it's so vital that we do what we're doing right now. We continue to fortify the population, roll out the vaccine at the speed that we are. Make sure, as Chris and Patrick say, everybody gets their second dose when they're asked to come forward when they're given their turn. But just make sure that we are cautious in our approach. I think that's the way to get the results that we want. Let's go now to Jasmine Cameron Chileshi of the FT.
Thank you. The Sport and Tourism Minister said earlier this morning that police will be able to intervene and fine any rule breakers where necessary. But how realistic is that? Will police officers be going around breaking up groups of more than 6 outside? Do you think that would be appropriate? And are you confident that the rules are clear enough to facilitate a consistent and fair approach to policing across the country? And secondly, as the number of coronavirus infections grows throughout Europe, why have countries like France not yet been added to the red list? And what is your response, Prime Minister, to concerns that throughout the pandemic, the UK has been slow to secure our borders from cases coming in from abroad? Thank you.
Thanks very much, Jasmine. On the first point about the policing, the police have done an absolutely outstanding job throughout this pandemic, and I think they've handed out about 70,000 fines at least for various breaches of one kind or another, and I make no apology for that. They will continue to do their best, but it depends more than it depends on the piece. It depends on general public understanding of what we've all got to do, and that in a way has been even more impressive. That's been the single thing that's made all this possible. On the imports of new variants from abroad and our border regime, we have one of the toughest regimes in the world. Some European countries, Jasmine, don't even have many European countries don't even have the hotel quarantine of the kind that we have in the UK, and there are 35 countries already on the red list. We're looking very closely at what's going on in France. We keep it under constant review, of course. Though, as I've explained to people before, there is the issue that our trade in medicines and food does depend very much on those short straits. So we have to make sure that we manage the disruption as well. Thank you very much, Jasmine. Let's go to Sophia Slay of the Evening Standard.
Thank you. Prime Minister, you said that you want this unlocking to be irreversible. Can you categorically rule out another full lockdown? And my second question is for Professor Chris Whitty. An Evening Standard
There's a variant that's immune to vaccinations and kills you. We're going to have a lockdown. You can't say there is no...
Are you shocked by that figure?
I'm shocked by the journalist's stupid questions today.
Well, Sophia,
hello, Carly.
The answer to your excellent question is yes, but with at least two very important provisos. Yes, if everybody obviously continues to obey the guidance with sufficient caution, and we continue to work together to keep the virus under control and get it down in the way that we have. And yes, if the vaccine rollout continues and the vaccines continue to be as effective as it looks as though they could be, or looks as though they are, Sophia. So those are the two conditions that would have to be satisfied. But I'm hopeful. I think that I don't see anything in the data right now that would cause us to deviate from the roadmap. But we've got to remain humble in the face of nature, and we've got to be prepared to do whatever it takes to protect the British public, which has been our approach throughout.
On the question to me,
to
the
you,
great majority actually of care home staff nationally have had the vaccine, and as have an even greater proportion of health care staff. I think for those who don't, I think there are probably three things it's really important to stress. The first thing is this vaccine will protect you and your family. And I think it is important that people really understand that this is it's important for everyone, but it's important for the individual who has the vaccine themselves and those around them. There's now evidence that if you have a vaccine as a health or social care worker, it's likely that that is going to provide protection to your family. Second thing is that there is, unfortunately, some misinformation about vaccines, and the key thing is to go to reliable sources. If you're hearing stories about vaccines and you're concerned about them, go to reliable sources, talk to...
I know someone who knows 4 people who's had the vaccine and all 4 were severely ill. They didn't die or anything. My mother had the vaccine and ended up being hospitalised. And then people wonder why I'm not.
All drugs and all vaccines is you're doing it because the risk of actually not being vaccinated is substantially greater than the risk of being vaccinated. And the third point specifically on care staff, certainly when we're talking about medical or nursing staff, I've said before, and I will say very unambiguously, I do consider people who are looking after vulnerable, other people who are very vulnerable, do have a professional responsibility to get vaccinated and to do other things that help protect the people who they're looking after. It's not just an issue about vaccination, this is across the board. Vaccination is one of those issues, and so it is important that people view it both for themselves, for their families, but also take their professional responsibilities seriously.
Brilliant. I think that's anything to add, Patrick. No, thank you all very much. See you next time.
Goodbye. Oh no, I have to be quick. That music is copyrighted. Now, as you can see from my plinth, I had to tell them that they'd done it wrong. They put the thing there and it said Downing Street and he couldn't read it, so they've sorted that out, and there were too many flags, so they got rid of them as well. So yeah, that's good. So yeah, I've absolutely no idea what went wrong at the beginning of this broadcast, other than I'm fuming. Fuming, what's that? Alright. What else has been going on? Oh yeah, I'll do it in the vlog. Right. Let's go back. Oh, it's gone off because it's been a while. Just see if we get sound at the start. Let's try. See the sort of the sound out on the video. No. So that's what went wrong at the beginning, which is why the video was all over the place at the beginning, so I do apologise about that. Anyway, that's it for tonight. So thank you, Carly, Toff, and DC number 9. Everyone else, don't forget to like, subscribe, etc. And I will see you all again, pardon me, next time. Until then, I'll be seeing you.